Hi, everybody. It's me. It's Dr. Kestler from Lorain County Community College, and welcome to today's COVID-video. I won't be doing one tomorrow or on Sunday. I'm trying to catch up with doing a lot of stuff. I've got a lot of, this is the end of the semester for us at the college, so I've got a lot of work to do to get through till next week. First of all, my temperature today is 97 degrees Fahrenheit. That's 37 degrees, 36.1 degrees centigrade. All right, so the first thing I want to talk about is, and I'm not trying to beat a dead horse here, but I just want to say the internet seems to be very still obsessed with hydroxychloroquine. So I'm just going to reiterate, here is another study that suggests that there is no benefit or little value in doing this kind of therapy for COVID-19 patients. I just want to point out that that's the conclusion. I actually printed their conclusion, and I came to the same conclusion looking at the data. I also saw another paper today, and that paper was on, this is a different story, and this paper is on the use of high blood pressure medicines. And I just want to point out that there was some initial concern about high blood pressure medicines being a problem because one of the receptors, one of the ways that COVID-19, the coronavirus, gets into cells is through one of the angiotensin receptor, and that the drugs might somehow cause problems. Well, I showed you some data last week that it didn't seem to be anything helpful or hurtful. But here's some data about a totally different virus. And this is about influenza. And influenza also can use that receptor. So people on these angiotensin inhibitors or people on the ACE inhibitors for blood pressure should continue taking them because there does seem to be a benefit. And they looked at 4 million people over 8.7 years in England, and they showed that you can see the data. I put it up on this slide where there does appear to be less incidence of influenza. So if you were using the drugs, so this is a good reason for everybody to continue using. I would tell everybody to on any prescription, any medication, anything that you're taking, no matter what, consult with your physician before you make any decisions about cessation. And then you can bring up and discuss things you've learned about them, but I wouldn't do anything differently until you hear from a medical professional about what you should do. And yeah, don't use the internet for that kind of thing. I want to turn my attention for the remainder today to the prison system. And the reason I want to talk about prison systems is it's a unique situation to study this outbreak, to study COVID-19, because of course these are people who we know are confined to one region. And one of the problems that came out, this is a report from Morbidity and Mortality Weekly Report from Louisiana. And they're more or less, this was a report that looking at this, just saw the problems, and it taught me about what the situation is in a place like that. First of all, those of you who are wondering why people are getting sent home from prison before their sentence is over, and there are a lot of people who are, especially for nonviolent offenses, like here in the state of Ohio. And the reason for that is that you can make spaces available so that you can do creative things like shifting infected patients to one region and keeping uninfected patients in another region, and also staff and all kinds of considerations like that. And of course, you got to keep your hospital beds sane, safe, and reserved. And so you do need to be kind of cognizant of that and prepare so that you don't have a real disaster. They've done a lot of interventions. I'm looking through the list. Of course, there's no visitation. There is plenty of sanitizing, hand sanitizer, and what they're all doing is screening new intakes, and they also should be, and this is something that works, is to quarantine new intakes. So before they go into the general population, they have a period of quarantine before they can be assimilated in the general population, and then all kinds of things make work, provided that you have the ability to do them and have the resources. I have been following, I'm going to just finish up with this story from the Ohio prison. I have been very interested in the Marion prison. Everybody was tested. By the way, in Louisiana prisons, let me go back to that for 2 seconds. There was a lot of differences in protocol, but there was a lot of testing going on too, so that before you return patients to the population, they tested negative by the RT-PCR, or that's the test that you, for the direct test of virus, whether you have virus RNA in you at this time, not an antibody test. Antibody tests are still not quite readily available in the country, but they did some testing on that. Well, everybody in the prison in Marion got. Let me switch over to the Ohio story. And, one of the good news pieces, I've got a good news story here from Ohio, and that is hospitalizations. As you can see in the inset, hospitalizations in general are down. That's in the upper left corner of this slide. And so the hospitalizations are down, except for hospitalizations in Marion County, which doubled this week, and I can only assume that is from the prison population. They're still quite low, and so it's something that we're following, and this will be a very interesting story as it develops, as we can learn a lot about how to handle the epidemic when we go out into the wild, if we will, for those of us who go out into the wild. For those of you who do go out, just make sure we don't have a lot of good testing. I saw a great paper this morning that was talking about the development of an app to tell whether you were distancing or not, to be able, or not to tell, not to report, but to tell who your contact were, contact tracing. Unfortunately, in the absence of testing, I'm afraid we'll have difficulty enforcing. We're already having people with quarantine fatigue right now, and I get that. I understand people are having quarantine fatigue, but without knowing for sure whether you're positive or negative, or you're getting better or you're getting worse, or you're carrying, I think that's going to be very difficult to implement that kind of a system. So I don't know what's going to happen there, but so right now we do have to, everything that we've been saying all along, I'm still seeing is true. It's about a 5-day incubation period. You need to wait 14 days after you've been positive. So if you do get sick for any reason, you should try to isolate yourself from 14 days from everybody else. And of course, wearing a mask is a worthwhile endeavor. That is something that you do want to do. All right, I'll stop right there and remind everybody to be good to each other, and to investigate, learn stuff, acquire information on your own, so that you can you will survive this, and we will survive this. So you'll survive it well, and may you all persist like a lentivirus. Thank you, and have a good day.